Hello and welcome to Politics at Sam and Anne's, the podcast that looks ahead. And today, healthcare, the NHS, its future, and the moral quagmire of assisted dying, which may be the biggest legacy yet left by this parliament. My name is Anne McElvoy from Politico.
And my name is Sam Coates of Sky News. Welcome to the box set summer edition of our podcast, where we give you everything you need to know about the term ahead in British politics, all the way up to Christmas, in what's probably the biggest traditional area for any Labour government, which is the NHS.
And with us to help navigate through that is our expert guest. It is Alastair McLellan, editor of the Health Service Journal, the HSJ, the insider's guide to what's really afoot in the healthcare sector. Since 2002, Alastair got the leak of the NHS 10-year plan over the summer. So I think that makes you first among equals in health journalists, Alastair.
Thank you very much. Yes, it was involved me sitting in a restaurant taking 182 pictures on my iPhone as my source flicked through the plan on their iPad. But such is the security around government documentation these days.
I mean, frankly, nobody would ever believe just how glamorous the sharp end of journalism is. Anyway, I just want to begin, before we get into any of the policy areas, to ask about the man at the top, Wes Streeting. Now, you've seen so many health secretaries. How do you think he's doing? And do you think he's putting his imprint on the NHS?
He strikes me as a very good politician, as good a politician as we've had as health secretary in the 21st century. He is a health secretary with no money, and that is always awkward to be. But worse than that, he's a health secretary with no money who has to pretend that he can do lots of things because he's new government and, we're going for 15 years of Tories, blah, blah, blah. So he needs to talk a lot. He needs to pick a lot of fights. He just needs to keep moving all the time, moving from one subject to the other. As a prime minister, you want a politician who is just going to flood the zone. So there's always something to talk about other than that existential question.
So what's interesting is that if you ask Keir Starmer what he thinks his biggest achievements are overall in any part of his government in the first year in office, he pretty much goes straight to the NHS, and he goes to the 4 million more NHS appointments and puts that top of his list. I have to say, Alastair, I'm always slightly surprised that he does this, even slightly troubling, because here at Sky, we've looked at that promise. And the thing is that 4 million additional appointments is actually a slowing of the rate of increase in appointments compared to Rishi Sunak's final year in office. So a 4 million additional appointments is an 8% increase on the year. But in Rishi Sunak's final year, there was a 10% increase in the number of appointments. So it's actually slowing.
Increase in elective activity dealing with waiting list outpatient appointments and procedures. The NHS is slowing down that growth very deliberately. Most NHS trusts are in deficit. The organisations they belong to, the integrated care systems, are in deficit as well. So they're trying to do as much work as they can within their budget. That is a very strong message from this government. You must operate within your budget. So, and most of that growth that Starmer talks about it was already baked into the system. Labour has done nothing apart from stopping the resident doctors' strike for a while.
So, Alistair, could you just bottom out the figures for us? I used a figure earlier, which I picked up from NHS England, I think, which was talking, well, it still exists. I was talking about 29 billion, which sounds chunky over a certain amount of time. But when you seem to be saying, well, there's not any more money on the table.
The story of NHS funding is during the Thatcher major years, it's around about 3.5%. New Labour comes in, it jumps up to 7%, massive. Then the crash, then under the coalition, it's down to 1%, though inflation is very low there. It knocks up a bit to about 4% during the Johnson years, jumps up a lot more during the COVID years, where cash was no object, though there were a lot of extra costs around, and then falls back down to around about that sort of Thatcher major average, around about 3%, where we are now. All of that money, extra money, all of it will be consumed by inflation by the fact that we've got a greater number of older people, which are higher consumers of healthcare, and you've got the introduction of new drugs and new technologies. There's nothing there to do something new, which is why the government have said anything new we've got to do has got to be paid out of existing budget, which means stopping doing inefficient things and starting doing things that are more efficient.
So, how does the 10-year plan really take that onwards if we want to have a more technologically enabled, more modern, more data rich health service? You kind of seem to be saying, well, we're not even anywhere near that yet.
The 10-year plan, which, as I said, is not really a plan, it's a plan for a plan. I think it should have been called "The Answer is Technology. Now, what's the question?" Because literally everything that is any problem that faces the NHS, it's basically suggested that the technology will be the way that you get around it. I would describe it as wishful thinking. So other kind of people might describe it as ambitious. Every time that government invests in it, expects it to deliver a cost saving in the near term. And almost inevitably, it actually increases costs. And then, as you stop dual running, as people become used to it, as there are no resistors in the system anywhere, then it begins to make a difference.
But I'm going to make us focus on the autumn, because demographic change forecast to leave us with a shortfall of between 260,000 and 360,000 staff, admittedly, over the next decade or so. So some things can turn out differently, but it's still huge. Bluntly, we'll never get this many people into the NHS. The cost would be astronomical. We now have nurses and doctors saying they're overworked, they're underpaid, their pay's falling behind. The tendency to industrial action doesn't look likely to abate. Do you think this is manageable at all for Wes Streeting, both practically and just in raw political terms?
There is no doubt that within the workforce, there is a desire for greater pay, but almost like a sense of, we owe something. We went through the pandemic, you owe us something more. Now, what will be really interesting, I genuinely don't know what will happen with the resident doctors' strike. Turnout, from what I can estimate, appears to be about 50%. During the strikes during the Tory times, it was sort of 80%. Massive regional variations, etc. It's not as supported by resident doctors, and it's not as supported by other people in the NHS and sort of the wider public sector sphere. I smiled when I saw that the only endorsement that the BMA has received from another union that I've seen was from Equity.
But do you think that strikes are going to become a regular feature of our summers, maybe our summers and our autumns, be they the resident doctors, be they nurses? Do you think the conditions that you describe and the atmosphere in the various doctor, nurses and other NHS representative bodies mean that this clash is only going to escalate?
I genuinely don't know. I mean, one of the really big issues for the government, it doesn't want to give the resident doctors any money anyway. It doesn't think they should have any extra money. But there's one thing it knows absolutely for sure, which is if they do give extra money, everybody's going to pile in the door afterwards. Because a lot of unions were incandescent. They could not believe it. They could not believe that their junior doctors, as was then, had got such a good deal without promising anything in return. So I don't know. It's really difficult to see how things go forward. And actually, I was very keen to understand from you two sort of the politics of this. If this strike continues to go on for a long, long time, and the one target that this government has set, which is to shorten the elective waiting times, that falls away. And what in their eyes is the greatest crime? Not delivering on the NHS target or having to pay unions lots of money? Could it be the thing that breaks Starmer?
What do you reckon, Sam? You see it that strongly?
There is no money left. A year ago, when Sue Gray was Keir Starmer's chief of staff, she would go around saying we cannot have public sector strikes. But now the thing that is really conditioning every other bit of this government is the fact that Rachel Reeves, the Chancellor, is facing a 22 billion to 30 billion pound black hole in the autumn. Government doesn't have a choice about extra public sector pay. It just can't do it in any big amount because it risks crashing into its fiscal rules and upsetting the bond market, which is a red line that no government would survive. So I'm afraid I don't see how a Starmer government can particularly start giving in, particularly if there's a domino effect, as you say, Alastair.
Jutting your chin, whether you are Wes Streeting or you're Keir Starmer, and saying, we have already given a bit, we've been reasonable, we've been Labour. You could say, well, we did what we could do, and we let you have so. You could invert it and say, we let you have something ahead of other people, and of course, other unions were cross, and of course, other people, particularly people, critics on the right, and the Conservatives and elsewhere, said you should not have done the deal the way you did, but we did it because it was in our heart. It was the NHS that we were doing it for. We can't go any further.
If they haven't fixed the NHS, can they win the next election?
You're too far ahead. You're too far ahead to the next election. I think it's such a long time. The unpopularity or less popularity of these strikes, I think, is noticeable in the Labour ranks, in the public, and even in the unions. But they will find something that has changed for the better in the NHS by 3 years' time. But they'll do what every government does, and every sensible health secretary that will try to separate out these groups, peel off those they feel they can deal with, makes the others look less reasonable.
There is one gigantic thing that might have changed in this country, well, certainly in England and Wales, possibly separately in Scotland, when it comes to healthcare, health provision, and that's end of life provision, and that is assisted dying, which is and isn't a plan of Keir Starmer's government. It's fascinating. In July, the Department for Health said that one of the department's 3 top priorities alongside the 10-year plan and dealing with the PACE dispute was the assisted dying legislation. And then Wes Streeting, who's against it, presumably saw that, took fright. They retracted that answer because even though it is in effect something that the department's going to have to manage, it is not something that they're meant to be doing because it's all being driven by backbench MPs. That's the kind of line that the government's having to tread. Right now, at the point of listening, and certainly the point of recording, the assisted dying legislation is in the Lords. This is where it becomes entirely unclear that the assisted dying legislation is going to become law. Now, in preparation for this podcast, I made some calls. I've spoken to people in government. I've spoken to some people in the various camps. Now, the assisted dying legislation needs to be on the books by May. That's when we expect the current session of Parliament to end. And if it's not there, it falls. So will it get through the Lords quick enough is quite a pressing and urgent question. But just like in the Commons, because it's a private member's bill, it needs to happen on Fridays. And it's not even clear that it'll happen in the first Friday that you get. There are 2 sitting Fridays a month in the Lords. All of that means that people I talk to think that there is a less than 50% chance that the assisted dying legislation hits the statute books. So even though there's been all this work, all this time and all this discussion, parliamentary procedure and the fact that they've got a hard time limit means that it might all end up in the bin, at which point Keir Starmer has to decide whether to revive it or whether to let it peacefully slip away, because ultimately it doesn't generate the kind of headlines that he wants to see. If that happens, Alastair, will that be a big relief for the NHS, or is this something that some people want to see?
I understand its cultural importance, but it's interesting the kind of numbers of people you would be talking about each year are so tiny in NHS terms. Operationally, it's just a non-issue.
And I'm guessing that something that Wes Streeting, his own position on this is known to be against assisted dying in the form it was put forward in the bill, but it's not something he really wants to fine him to spend much time on. Actually, I don't think I've ever asked Sam this so directly, but both of you, Wes Streeting's a big fish. He's there in this government. He clearly has ambitions that could go even beyond the Department of Health. Imagine, if you will. He has a character. People like to be around him. He's engaging. How do you think he's doing kind of personally in terms of putting his imprint on the role of health secretary, where that might lead him?
Wes Streeting is undeniably one of the most politically talented communicators in the cabinet. And I think Alastair gets it spot on when he said earlier, look, I think he's the kind of guy who just knows how to articulate at a time where there are enormous constraints. But I do wonder whether or not he is a technician of the sort that this moment requires. The target that Keir Starmer has, perhaps even inadvertently set for this government, the 18-week wait target that this government is so far off. The claims around more appointments that turn out to be a slower increase than we saw under Rishi Sunak. I wonder whether or not he is the person to deliver. He might be the man for the moment, given how few tools he has. But I wonder whether he makes it through the entire Parliament in the same job. If Alastair's description of West Streeting is correct, then that suggests to me that there is a shelf life to the amount of time he is in the role at the Department for Health. I also, a bit of me wonders whether or not assisted dying isn't incredibly important to him, and he wouldn't actually want to be Health Secretary at the point where that is rolled out as a policy, ultimately a government policy, because it would be for government to implement, even if MPs imposed it on the government through that private member's bill.
He wants to go far beyond that, Sam, because he's on record as saying that he wants to deliver the 10-year health plan. So that would suggest that he'd be health secretary for 10 years. He's not a health secretary like Jeremy Hunt, who's sort of captured by the subject. He's clearly an ambitious and highly talented politician, and you could well be right about assisted dying. I've never really talked to him on that kind of level. So it's not a lack of technical expertise that this government get. It's got lots of it. It's that there is no part of the financial engineering of the NHS, not one part, that is not currently being reviewed or reformed in some kind of way. There's some vague ideas about what it's trying to achieve, but nobody's worked out the detail. And they're not just one piece, they're doing all of them at the same time.
I do like the idea, Sam, that you go, doctor, I've got technical experts coming out of my ears. Please find me the clinical path to deal with this. Final thought, maybe. Sam, what do you reckon?
I just think that when politicians say, I want to be here for 10 years, that's normally a sign that they are intensely relaxed about moving on. Now, being intensely relaxed about moving on is probably where we need to be at this point, which leaves it down to me and to Anne to thank Alastair very much indeed for joining us. I've learned a lot about what's about to happen in the health services and the challenges to come. So, Alastair McLellan, thank you very much indeed. And also to Anne.
Thanks so much, Alastair.
Cheers.